Good afternoon. Welcome to our monthly webinar, our state webinar. My name is Ingrid McDonald, and I am a director with the Senior Transformative Agenda Implementation Team. Today we are discussing collective accountability to affected people. It's a really important discussion. It's one of the three core pillars of the transformative agenda, one of the main areas of the World Humanitarian Summit in many ways in its relationship to the principle of humanity, and one of the core work streams of the Grand Bargain. Just before we move and talk to our speakers, our distinguished speakers today, just a couple of ground rules. Today's webinar will be 60 minutes. The first 30 minutes will be questions that the speakers will be asked by myself as the host, and they will respond to outline the topic. Then the last 30 minutes, the second half of the webinar, is we will take your questions and direct them to the speakers. I would really encourage you to send through your questions. We try and make this as interactive as possible and as useful as possible and as practical as possible for you. So if you have a look at the right-hand side of your screen, you'll see that there is a chat box function. Please send your questions there. You can also exchange and chat with each other through that mechanism. But if you'd like to direct them to us, you can do that either in a public way, or you can send it directly through to the host. For those of you who have a poor internet connection or audio problems, just if you have a look on the screen, you'll see that there is actually a link to a YouTube link there. You can actually go onto that link if you're having a problem, and you can listen through there. So, with collective AAP, why are we talking about it? As I outlined, it's one of the critical areas in terms where we work on. But the title, as you see, is Beyond Listening. Now, of course, on a day like today, which is International Women's Day, where we celebrate women and the role that women play and how incredibly important they are, I think for AAP, this is also very relevant, and this is one of the reasons why we actually wanted to put this webinar on today. When we talk about AAP, it is actually beyond listening. AAP is also about participation. It's about ownership. It's about influencing humanitarian action. It's not only about how we engage with the population in terms of communicating, it's about how we integrate their perspectives, the way that is relevant for their context and for their needs and priorities within our response, how we adapt to that, how we understand, and how we actually ultimately improve the quality and targeting of what we do. And fundamentally for us as humanitarians, it's very much about dignity, which is the basis of humanitarian action, and ensuring that there is informed consent from the population. So AAP, as it's been defined, very much looks at the issues of listening, of feedback, of communication, and of complaints mechanisms, and then how we respond and adapt. What you see in front of you at the moment is a model where we've attempted to put forward how to really illustrate the area of collective AAP versus individual AAP. Now, individual AAP mechanisms are something that many organizations have and are very often well developed, but they're normally focused on how an organization does its own monitoring, its own engagement, its own adjustments within the program cycle of that organization with the population that's benefiting from its response. The difference with collective AAP is it's looking at the totality of the response. It's not only what individual organizations do, it's how all that information, whether it's through the individual AAP mechanisms, through radio programs, through joint call centers, through perception surveys, all these different areas that you see in that model in front of you are brought together, and how then that feeds in to how the response is being designed, how the response is being implemented, and then how the response is being adjusted, and very much about having people at the center. So this is what we're going to be talking about today, and of course that is critically important for humanitarian coordinators and humanitarian country teams and their ability to make decisions. We are very lucky today to have on the line from the Democratic Republic of Congo, the Deputy SRSG Humanitarian and Resident Coordinator, Dr. Mamadou Diallo. Dr. Diallo is highly recognized and has been in many different locations, and this is an area that he knows exceptionally well because, of course, he also comes from a medical background where that engagement with the population and the issue of consent and understanding what people need and adapting is critical for them. We also have Charlotte Lancaster, who is the head of the IDP Iraq call center, and she is someone who has worked also in a variety of contexts and has really driven what is considered to be one of the world's best examples of a collective AAP mechanism. We were lucky enough to meet to look at the Iraq call center when the state actually took a interagency team to capture best practice learnings last year. And we're also privileged to have on the line at the moment Shirley Lowe from World Vision International, who was part of that team, who helped us develop a note for humanitarian coordinators to set out some of the key steps that they can take. We will be circulating this later. So I just wanted to really acknowledge how lucky we are to have this distinguished panel and then move forward in terms of our first question. Before doing that, just so if you have a look at the right-hand side of your screen, you'll see that there is a poll that has just been opened. It takes about a minute just to fill that poll in. It's really important for us because it helps us to improve the quality of our webinars. So if you don't mind filling in that poll while we actually move to Dr. Diallo for our first question. Dr. Diallo, as a humanitarian coordinator, what would be interesting to hear from you is what concrete steps you have taken together with members of your Humanitarian Country Team to put in place a collective approach to AAP across the DRC response.
Thank you very much, Ingrid, and good afternoon or good evening, colleagues, depending on what time zone you are in, and greetings from Congo, DRC. Actually, in the DRC, first we decided in approaching the issue of accountability to affected people is really to get a clear sense of direction and agree with that sense of direction with the entire humanitarian community. It first fell to the HCT to define that sense of direction and then try to get the buy-in and the support from the entire humanitarian community on moving the process forward. In fact, what we decided was first, this was not to be just left into the realm of the HCT. That was a collective responsibility and collective accountability throughout the entire humanitarian community in the DRC. We set out first to find what is our rallying cry, what is our rallying slogan, and what is our core principle. And the core humanitarian standards, which were adopted globally, actually provided a good frame for us, and we were among the first HCTs to adopt them first and try to use them into our planning and programming processes as a frame of reference. Out of those core humanitarian standards, we also took stock of and developed fully the 9 commitments to improve quality and effectiveness in the way we do these things. On your screen, for those of you who have a screen in front of you, you have these core principles, core humanitarian standards that we've listed, ranging from 1 to 9. Humanitarian response being appropriate and relevant, humanitarian response being effective and timely, humanitarian response striving to strengthen local capacities and avoid negative impacts or effects, humanitarian response based on communication, participation, and feedback, humanitarian response that provide adequate space and means to take stock of complaints and concerns and welcome and address them in an open, full, and transparent manner, a humanitarian response that is also coordinated and complementary with other initiatives, both nationally and locally, and a set of humanitarian actors who strive to continuously learn and improve, staff on humanitarian actors who are supported to also do their job effectively, imparted with the skills and the knowledge, and who are treated fairly and equitably. And finally, dedicating resources, adequate resources, and also making sure that resources are managed and used in a way that ensure responsibility and that respond to the specific needs of the intended people and the target people and the intended purposes. With this, actually, how we move to implement the AAP in the context of the DRC, we went back to really revisit the opinion poll, and also we started a discussion at the level of the HCT to make sure that we have a common understanding of what we wanted to do, how we would do it, and what will be the common framework for ownership and leadership and stewardship of this approach. We also set out to clarify roles and responsibilities, both of clusters, members, cluster leads, and also individual agencies and organizations. We also, through those discussions, we generated a momentum within the HCT and in the broader humanitarian community, and also shared the clear strategic directions on how we intended to do this. I have to say that actually the common humanitarian standards, core humanitarian standards, provided us with the opportunity to expand training and capacitation throughout the humanitarian community by providing locally translated content in the local languages for our NGO and local partners, communities, disseminating those information using the appropriate channels, and also providing the training of trainers and any other capacitation needed for our partners to understand the rule of the games and also be able to implement those in their own realm. And we also engaged the intercluster, including non-HCT members and other operational actors, both local and international, and also secure their ownership and their participation. With this, I think we set the right frame and the right approach and the right ownership for the process to move forward. I hasten to add that also in the DRC, these things started not necessarily as late as 2015 or the like. Some of this work has already started years back, but actually we just found that actually it did dovetail and support very well the AAP initiative. And some of these things included, for example, the issue of the setting up in the DRC as a first in the region and in the world of the Rapid Response to Movement of Population Initiative that we call here RRMP, and also the Humanitarian Pooled Fund, which has been now in operation for the last 10 years. These tools and mechanisms provided us with a lot of background knowledge and understanding on how we can build the issue of accountability to affected population using these existing tools. We also tried to work through the Good Humanitarian Donorship Initiative, which also is something that is very well and alive in the DRC context, that also helped us a lot in understanding how to secure the buy-in and the support from the donors, how to make them understand that actually dedicating resources in capacitating, strengthening the programming, the goodwill and the understanding of humanitarian actors in the accountability realm would be resources well invested, as they will help downstream to make sure that actually we get the buy-in from our beneficiary populations. We have all of these things in place, and actually we also take the step of providing some of the technical support needed through OCHA, through a dedicated CHS advisor who worked with communities to understand their experiences and perceptions. So all of these things now lead me to conclude by saying that actually we don't see this as just an added task. This is part of our work. And by revisiting what we have done in the past, we can also say that we've initiated some of these things without specifically knowing that it meant specifically to address the issue of accountability. But we're now finding out that actually we have a solid ground on which to base now our dedicated work to improve the accountability to affected people in the DRC. Over to you, Ingrid.
Thank you very much, Dr. Diallo. I think that what you've done is really provide us with a very comprehensive framework of actions that have been taken to really put AAPs throughout the program cycle, use various projects, and bring that all together in terms of also defining the roles and responsibility, which is incredibly important. I'd now like to move on to really ask you, you've done all this work, but how has this collective approach to AAP by the HCT and within your own leadership made a difference in the DRC? How has it guided the strategic direction of the response? And do you have any examples of where this strategy has been adjusted and how that has been practically taken forward in the DRC?
Well, thank you, Ingrid. As a response to this, I would like to offer two reflections. The first one is the issue of the AAP within the context of the humanitarian response and in the context of what we call here in the DRC, the transition period. Many of you know that actually we operate in a mission setting where we have the peacekeeping operations of the United Nations. We have the UN country team on the development and transition and stabilization side, and then we have the humanitarian community. What we saw in the work of the humanitarian community, we thought was a very good ground to start sharing information with the other two parts of the process in the Congo, meaning the peacekeeping mission and the development community, to make them understand that actually our collective aim of working towards stabilizing DRC and making the country move forward would be better served if all of us in our individual capacities and programs use the AAP approach to try to be more accountable, to have our program speaks more to the needs and concerns of the people that we need to serve. That has been trickling down to the HCT, to the UN country team, and also to the mission in our forum that we call the Senior Policy Group Meeting, where we discuss issues of transition, where we discuss issues of collaborations. And there has been a heightened interest on the issue, on the UN country team, for example, on knowing exactly how the HCT set out to define this. We've shared all the approaches that we have taken, mostly in, first of all, securing the buy-in. Also making sure that actually our programming tools and processes do include a sizable portion of the insights, the comments, the concerns, and the inputs of the affected populations before we design programs. It's a painstaking and slow process, but the return on investment, we see them as significant, because when we get the buy-in from our affected populations, when we have them on board in designing the programs, implementation becomes easier, and the return on the investment that we make in every dollar is higher than if we just go out and design things and try to cut and paste them and put them in action without consulting the people. For example, one of our program here that has been gaining momentum is the issue of cash programs. UNICEF as the lead, the cluster lead on NFI and shelter, and also as the cluster lead on the issue of health and RRMP manager, has specifically worked with communities to find out what is the best approach and the best schemes to make the cash program work, not only for responding to acute needs, but also in helping bridge gaps among the communities, try to get communities together and try to revive the local livelihood program and the local economies through the cash and voucher programs. But this could not have worked because Congo, it's a big country, it's one country, but it's such a diverse country that you cannot just cut and paste programs from one area to the other. So UNICEF painstakingly and exhaustively went out to seek input and guidance and vision from these communities, and the programs that we designed that now use both the food security, that the food security cluster uses and other clusters, are meant to respond specifically to the needs of the communities. Maybe a little further down the line, the issue of also working with communities to reduce the needs. We've also come to understand that most of the things that we do in the Congo has mostly been doing things downstream and not acting specifically on one of the recommendations of the World Humanitarian Summit, which is working upstream to reduce needs. And in the context of the Congo, and that also brings me back to the RRMP, it is important to understand what are the causes and the drivers of displacement. And if we do, and now I think we understand very well how we work with communities to try to take away those drivers, to minimize their impact, to try to bring more community cohesion and more discussion, more community conflict resolutions approaches that will stem the tide of displacement, reduce the need for displacement, and where displacement occurs, provide a framework to implement durable solutions within the context of existing either laws, global laws, but also customary laws and other community conflict resolutions mechanisms. So these are how we are approaching these things. It's still work in progress, but I think we have a very good learning ground, and we will be step by step documenting some of these initiatives, and then at a time just share them with you and other colleagues so that it can be shared globally with other HCTs. Over to you.
Thank you very much, Dr. Diallo. I think that capturing that practical learning so that it can inform other approaches is exactly the type of work that is required on an important issue like this. And the example that you provide, particularly in terms of cash and vouchers and the use of the RRMP, I mean, it's very tangible and it's very, very relevant. And so I think that we definitely will be returning to that in the question and answer section. I really do encourage our audience to use the chat function. Please send in your questions. We do have Dr. Diallo here who can answer these really important questions. So I'm now going to go over to Charlotte Lancaster. As I said, the state had the privilege of being hosted by OCHA together with the Iraq call center in Iraq earlier at the end of last year, where we actually really saw in action how important this mechanism is in the field. We traveled with an interagency team with World Vision and Amal from Lebanon, and we're able to capture some of that learning, which is on our website. And so we really thought it would be good to put forward sorry, we've got someone who's got their video on. Thank you. So to put forward this example, so Charlotte, the Iraq IDP Information Call Center it's considered one of the best examples. Can you describe what concrete steps were taken to establish and maintain the call center, and what support from the senior leadership has been important for ensuring its success?
Thanks, Ingrid. Thanks very much for having me today. It's great to be a part of such an important discussion. Well, as you can imagine, there were several key steps to establish the call center. And in fact, it was born from an interagency collaboration that started with a needs assessment that looked into the communication and information needs of IDP populations in Iraq. And it came together at the right time, people who had a vision and the drive and the required resources to not only conduct this interagency needs assessment, but then to sign project agreements and to pool resources, whether financial or in-kind, to bring to life this call center. Following the findings of the needs assessments, the HCT, the Humanitarian Country Team, endorsed the recommendation to establish a two-way communication channel in October 2014. And this endorsement was actually referenced in the operational peer review of 2015 as a first step towards achieving a comprehensive approach towards accountability to affected populations in Iraq. Now, following this groundswell of support, naturally the next step was to better engage with the ICCG to secure buy-in with humanitarian partners across the board.
Mateo, did you take off your lentillas yet? Are you eating your snack yet?
Okay.
Are you doing your homework yet?
Excuse me.
Would you get your snack, please? Could you call Fatima to do your snack, please?
Philippe Taminga, can you please turn off your microphone? We're hearing about your children and your snacks. Back to you, Charlotte.
Okay, thank you. Yeah, as I was saying, another key step was to engage with the intercluster coordination group. Obviously, we work through them to secure buy-in from all actors, but also to establish frequently asked questions and information management procedures and processes so that we could anticipate ahead of time the questions that callers may ask. Another key step was the establishment of a project board with representation from key partners, including the Humanitarian Coordinator. And this board has been crucial in guiding direction and keeping the focus of the call center, while also simultaneously reinforcing the collaborative spirit, which has in part also helped to raise awareness of the call center, not only among affected populations, but also among the extensive network of humanitarian partners working in a field across the entire country. and in a country that's also experiencing different levels of conflict at various times. Of course, during this establishment phase, there's lots of lessons learned and challenges. One key challenge and lessons learned would be the importance of preparing and mapping out the landscape, not just the needs of affected populations, but also the capacity of the technological infrastructure of the country. We learned the hard way that you have to allow substantial time for the import and configuration of technical equipment, and to make sure that in countries such as Iraq, that bureaucratic processes and unanticipated hurdles don't weigh down the setting up of such a mechanism. Further, the call center is funded by multiple donors, and aligning organizational, financial, and reporting requirements has been a key development and a key ongoing challenge. With multiple donors, you have obviously multiple requirements, forms to fill out, financial reporting times, and so we learned as early as possible in the project cycle, and even possibly before the project is launched, to consolidate expectations, reporting, and financial requirements. Alternatively, collective accountability mechanisms could be well placed by being prioritized through collective pooled funds. Centralized funding, in my opinion, may allow for more flexible and longer-term funding cycles, while simultaneously keeping the neutrality of a collective accountability mechanism. Now, as much as the senior leadership support has been crucial in the establishment of the call center, it has also been important as the call center develops and evolves. The DSRSG HCRC in Iraq is on the project board, as I mentioned earlier, and engages with the call center regularly. Further, she endorsed the call center as the main clearinghouse for the prevention of sexual exploitation and abuse Iraq's task force. Additionally, the Humanitarian Country Team has identified accountability to affected populations as a strategic priority in the Humanitarian Response Plan of 2017, and has dedicated a page to AAP, specifically highlighting the call center as a collective accountability mechanism. Further, during HCT meetings, information and data analysis shared by the call center has been shared by partners through materials such as the UNHCR's Critical Protection Report and IOM's Returns Working Group presentations. This pooling of materials and information at the HCT level once again goes to strengthen the call for collective interaction. At the operational strategic component level, the Inter-Cluster Coordination Group regularly invites the call center to present at meetings, and in early 2017, it was agreed by the ICCG that the call center would become a standing agenda item to present on key trend analysis, needs, and gaps. But beyond the HCT and ICCG, it's been really important to engage with NGOs, both bilaterally and through the NGO Coordination Committee for Iraq. And this collaboration and engagement has been crucial to the expansion of partnerships with the NGO community that obviously has a wide spread across the entire country and dealing with various aspects of the response, and has been key to the successful implementation of the call center. Further, prioritization of support within agencies has been key to the success of the call center. There has been consistent interest and support from senior management at the highest levels. Last year, the High Commissioner for Refugees came to visit the call center when he was visiting Iraq as part of a mission, and the heads of OCHA and UNHCR in Iraq have also come to visit the project, demonstrating that the prioritization of AAP at a senior leadership level is taken seriously. Of course, there's an array of challenges and learning we're tackling is to improve the alignment of data collection processes with partners so that we can more efficiently triangulate assessment of needs to be leveraged at the ICCG, which is our entry point to the HCT and to that decision-making level that can affect strategic direction of the response. Another key point, of course, is the ongoing and continuous need for senior leadership to endorse the importance of the collective accountability mechanism at each stage throughout the operation to all partners to strengthen this interagency collaboration and to push AAP agenda to the next level in Iraq. Thank you.
Thanks very much, Charlotte. I think that's really given us a lot of steps in terms of that you've taken to work through setting up the call centre, and also then how you've taken to work with the other actors. But to take it the next step in terms of, just as we asked Dr. Diallo in terms of how does it make how the work that's been done in the DRC has made a difference, what would be interesting is also to hear from your side very quickly how the HCT, the clusters and the agencies, how the work of the call centre has made a difference in Iraq, and what you see as being the key learnings and next steps for 2017.
Thanks, Ingrid. So as we know, the call centre, as a collective accountability mechanism, it's more than just a mechanism. We use it to identify cross-cutting issues, to tap into cluster-specific referral pathways, and to connect people with support services across the humanitarian response, regardless of clusters. At the same time, we're also using information gathered from callers to consolidate cross-sectorial analysis and information from across the country. We have 9 dedicated operators, of which 5 are women, and these operators communicate with callers to and help support establish accountability mechanisms by absorbing the labor-intensive activity of listening and communicating with communities across Iraq on a range of issues, regardless of topic, cluster, or location. These operators are also systematically capturing data while taking account of the different needs of communities from an age, gender, and diversity perspective. Of course, as part of our daily work, issues are documented, needs are identified, gaps are flagged, and information is communicated to callers. For example, how they can be connected to services, how they can register for assistance, and how they can access partner hotline numbers. Of course, as part of the feedback circle, the call center then shares data on issues, complaints, vulnerable cases which have slipped through the cracks, needs and service gaps with partners. This data is shared in an operational level package with organizations and clusters on a daily, weekly, monthly, ad hoc basis through a variety of reporting streams that contribute to a pool of evidence-based data that can be used by top-line donors and by the response to help improve the relevance of programming. So, for example, the call center recently received a spike in calls relating to food distribution and family sizes. This information was shared with WFP's accountability team, who used it to advocate for a revision in distribution policies. Further information gathered by the call center in areas recently retaken by the government has alerted the rapid response mechanism to food insecurities. Following Mosul, the returns is expected to be a big issue as part of the response this year, and the returns working group is integrating our data in overviews, recommendations to partners on needs, is using it to advocate and to target messaging to affect populations. Another example, WASH Cluster is also working with the call center to, for example, better map out possible water points that affected communities can access in eastern Mosul. The Cash Working Group is using data shared by the call center to shape its 2017 communicating with community strategy. And information shared by the call center is also leading into, or has led into, high-level advocacy that, for example, has prevented forced returns in certain governorates. Additionally, the call center has a very unique advantage. We're a toll-free hotline that operates across the country and is accessible for free on the country's 3 telecommunication networks. As such, it gives us a unique communication channel to people living in hard-to-reach areas and under ISIS control, and is allowing us to feed information back to partners to identify needs in those areas and to help pre-position stocks. As mentioned earlier, the ICCG is our entry point to access the strategic decision-making level of the HCT, and about 60% of our calls are requests for assistance. By sharing information about these requests at the ICCG level, we're helping to build a system that can ensure cross-sectorial requests for assistance, the identification of priority needs, and that the voices of affected populations are taken into account at decision-making processes and at levels. This also helps to harmonize delivery of programs between the clusters and HCTs. And you asked about learnings and next steps. Well, in 2017, and in an operation the size of Iraq, the call center is planning to link with the newly established assessments working group in order to triangulate the different levels of assessments, including, for example, the self-assessed needs, agency assessments, intersectorial assessments, and rapid assessments, in order to provide, once again, evidence to build into a pool of data that can help shape and improve programming and make it more relevant to the needs of the people on the ground. Another step we're planning in 2017 is to strengthen our follow-up. One way we hope to achieve this is through continued review of effectiveness of the call center by analyzing our quality of service, but also to better gauge caller perception of accessibility to and relevance of services to which the call center refers callers. And additionally, we would like to work more strongly with our partners to better document how the call center is positively influencing the humanitarian program cycle. Now, aware that we're limited on time today, I'd just like to wrap up by saying that it's important to remember, and Dr. Diallo commented on this as well, that there's a collective accountability mechanism. It's just one part of a broader AAP platform operating in Iraq. It's just one channel. And as the operating environment in Iraq changes over time, the collective AAP mechanism must also adapt. It must also evolve and mature with the response. As we move forward and into this year, the call center will continue to leverage the sectorial and intercluster platforms to raise the voice of affected populations at a decision-making level to help build a better response in Iraq. Thank you.
Thank you, Charlotte. That was a very comprehensive response in terms of impact. So I think that really gave our listeners something to really think about. I would encourage those of you on the line to please continue to send through your questions. We've received some really excellent ones. I'd like to go to you, Dr. Diallo, with the first question, and this isn't surprising given that today is International Women's Day. How has the CHS and the way that you've worked with the CHS in the DRC, how has that helped you uphold and pay more respect to the dignity of women in the DRC? How has it allowed you to involve them more and to be able to ensure that the response is adapted to their needs and priorities?
Thank you, Ingrid. The issue of the dignity of women and how the AAP looks at and try to support the work on improving not only the safety, security, and dignity of women, but also enlisting their participation and their input into program design and program implementation is very important in the context of the Congo because of the heightened scrutiny that humanitarian action in the Congo, along with peacekeeping operations and other development actions, have come under in the past few years related to the topic of sexual violence and then sexual exploitation and abuse. The humanitarian community actually has been very keenly looking at ways of using the accountability framework to also make sure that actors on our side understand their collective responsibility in ensuring that whatever we do in terms of humanitarian response respect scrupulously the issue of do no harm, that nothing in the actions, in the assistance, in the programs that we develop and implement should put any of our recipients and our beneficiaries into harm's way. That requires for us first to understand what are the perspectives of some of the most vulnerable among the people that we assist, including specifically women and young girls and the young people in general. What are the issues that are at the heart of their concern in terms of their safety, their security, their dignity that need to be taken into account into our programming processes and tools? In that regard, I think we go to great lengths to try to elicit their input, to elicit to dig out their concerns, and to look at differentiated approaches in specific settings where you have the action of armed groups, where you have the issue of militias, where you have heightened inter-community strife and inter-ethnic conflict, to ensure that some of these parameters are mainstreamed into our programs so that whatever we do is meant to enhance the security, safety, and dignity of women, girls, and young people in general. I think it is time well invested in efforts because actually we have received a very keen response from those communities in that they have been coming forward and providing us with a lot of information that has proved to be very useful in our programming processes. For example, most of the sexual abuse and exploitations have been perpetrated in some of these areas by armed groups and also by some of the state actors and some of the non-state actors. So this has helped us understand in the humanitarian response settings what are the things that need to be calibrated to ensure that actually those among these likely perpetrators do not have any way of using any of the interventions to really try to pry on some of these groups. And likewise, in designing these programs, we also made sure that we understand how best the setup and the delivery of these programs will ensure maximum dignity and protection of some of these most vulnerable groups. I think moving forward, our ambition is really to take that to the next level and try to help the humanitarian community, the development community, and the peacekeeping operations in the Congo to redefine and contextualize the issue of human security in the context of the Congo, and try to integrate into that concept of human security the dignity of the most vulnerable, including specifically the women and the young girls. It is a discourse that is starting to take root, and I think there is a lot of goodwill on the part of the mission and the UN country team to try to learn from what the humanitarian country team has done, and then try to move forward. My last comment on this is that actually we're also building up the capacities and the involvement of the local humanitarian players and the local NGOs and other actors who are keen to join the broader humanitarian community in the Congo. And among these groups, we have a lot of well-organized women and youth groups. And because of their close relationship with some of these affected populations, we believe that building their capacity and making them part of the mainstream of our actors and our players and our implementers will also open a new avenue for us to reach out, explain, win over, and get the support and the buy-in of some of these affected populations to make sure that whatever we do does not cause any harm, and whatever we do is part of the whole process of securing their safety, dignity, and security in the assistance that they receive from us. Over.
Thank you very much, Dr. Diallo. I think those are some really important points. It's not just about communication, it's also about how to strengthen the quality of the response to make sure it's appropriate, to safe, and really putting that dignity at the basis. Charlotte, we've had a question in terms of the call center. Really, the call center is quite an important mechanism, but is there a concern that there can be this over-reliance on technology platforms like hotlines and call centers? What do you think can be done to triangulate the data and to verify the accuracy that what comes through, so it's not just based on what happens with the call center? And are you aware of efforts about how that's been taken forward in Iraq to ensure that it's not just about only those who have access to a phone, but to ensure that there's a variety of different ways of pulling data together?
Yeah, thanks, Ingrid. That's a great question. So yes, I mean, as I mentioned earlier, the call center is just one accountability channel through which communities can communicate with the response. Every agency has their own internal accountability mechanisms, and people engage different forms, whether it's complaint boxes, mobile teams, face-to-face groups, face-to-face sessions. And now all this can lead together at an agency level to provide feedback. I think an area for growth with the response in Iraq would be to, and this all feeds into the ICCG level as well, and can help shape programming at a high level and feedback. What would be interesting for me as well would to see community engagement, the feedback to them at a collective mechanism level as well, to see how better we can communicate with them what we're doing at a collective level with their information. And I think in terms of a reliance of technology, well, yes, the limitation of the call center is that if you don't have access to a phone, then it's hard to call in. But what we see, and we get asked a lot about how many unique callers we receive a month, and it's interesting because an easy way of gauging that would be by looking at the number of individual phone numbers and unique phone numbers. However, what we see is a lot of people in the communities will share mobile phones, and so we receive a phone call from someone, then when we make a follow-up call to follow up with their issue, it's someone else answers the phone call, and it's interesting. So and talking about technology there as well is trying to engage with women as well. A lot of female callers that call in, they like to give the name of the family member instead of their female name. I think that yes, there can be reliance of technology. I think technology has a really strong role to play in a response, and especially it's interesting to look at SMS communication as well. But I think that the call center as complements an overall system, accountability system, by providing one extra channel through which people can communicate. Yes, there will be people who prefer to communicate face-to-face, and there are plenty of mechanisms on the ground to facilitate that.
Okay, so, thank you very much, Charlotte, for that. I think that gives a really good answer. Dr. Diallo, we have an interesting question that's just come in, but before we go to you with that, I just want to point our listeners to a poll that's about to open on the right-hand side. If you could take a minute just to fill in that poll, it just gives us a bit of an idea for you to put forward some thoughts about how we can improve our webinars in the future. So Dr. Diallo, AAP needs a strong community element. It's very important that it's rooted in the community, it's rooted in terms of the affected population, and often local actors, particularly civil society, will be engaged in that, but also you have government engaged in that, of course, and there's many different elements and levels of government. How do you get government buy-in in the DRC? How do you ensure that the AAP is also has the engagement of government in terms of what you do?
Thank you, Ingrid. In fact, I have probably taken a step back by just sharing with the audience that actually the government of the DRC took at heart most of, if not all of the recommendations coming out of the World Humanitarian Summit. In particular, the issue of reducing needs and the issue of using national capacities and mobilizing local resources to try to respond and strengthen humanitarian response, I think rang a very good bell with the government of the Congo. And since then, that has been the main topics on the discussion that we have with the government and the local actors on the platform of humanitarian action coordination in the Congo that we call in French le cadre de concertation humanitaire, CNCH. From that broader policy outlook and the policy interest from the government, we've set out to make the government understand that actually there is a role for them to play, because what is envisioned by the UN country team is to make sure that actually we continue building the capacities of local players and local actors so that the response and most of our programs also benefit in terms of increased capacity and better operational capacities from the local players. With the understanding of the government and also through the Humanitarian Country Team, we've set out in a deliberate fashion to make sure that our pooled humanitarian fund, our common humanitarian fund, does provide specific funding windows and opportunities to support actions by local players with a view of not only strengthening their capacity, but also making them part of the mainstream of the providers of assistance in the humanitarian. That has registered very well with the government, with the local players, including NGOs and other things. We also set out to make sure that actually they are part of the decision-making process. We've specifically went out and requested for volunteers to be part of the Humanitarian Country Team, and we've had national NGOs designate their own representative, which is National Caritas, that now sits into the Humanitarian Country Team. And we also went out, because of the size of the Congo, knowing that actually the HCT sits mostly in Kinshasa, in a country that is 2.5 million square kilometers, to design locally setup of the HCT that we call the CPIA, which is a decentralized type of HCT, that looks at programming processes, data collection and analysis, and conflict analysis, and other things on the ground that feeds into our humanitarian need overviews, our humanitarian needs assessment, and also our humanitarian need planning. These bodies, working very closely with the clusters and the inter-clusters, have been very helpful in making sure that we have a solid humanitarian architecture in the Congo that takes stock of the size of the country and the complexities of the situation, but also help us make decisions with a local flavor when called for, with the blessing and the political guidance of the HCT. And also, lastly, what we also have done is that by choosing deliberately from this year on to go into a multi-year humanitarian response planning process and to have a multi-year humanitarian response plan, is also a way for us to try to build this capacity from the government to understand how we plan for this, how we approach our donors, what is the main line of messages, and also how we make our national partners understand the link between responding to needs and the need for the government to help us also upstream in trying to reducing needs by specifically addressing the drivers of conflict and insecurity that are at the core of displacement in the Congo, where we have now more than 2 million internally displaced people, mostly related to interethnic conflict, intercommunity strifes, the fight over natural resources and land, and the other issues that have really driven these conflicts for decades and that have forced people to move from their areas of origin and try to seek safety and security and opportunities elsewhere. All of these conflicts are a little bit beyond the realm of the humanitarian community, but working on them by making the government and some of our local players who understand the dynamics to try to work on them would also reduce the needs and help us downstream look for durable solutions on the issue of displacement specifically, which has been plaguing the DRC for more than 2 decades. And maybe lastly, what also is important to note in our context here on the government buy-in and localization is that actually there is a will from the government side to understand more its role of advocacy and support and policy directions. The government of Congo is pulled apart with million priorities, but it sees addressing humanitarian needs as a good investment on stabilizing the country. So we're trying to size on that goodwill and try to help the government design policies and programs that will also help us create a conducive environment and an open humanitarian space for us to be able to work with them to stabilize the country and try to address these growing needs in terms of displacement. Over to you, Ingrid. Hello. Over to you, Ingrid.
Thank you very much, Dr. Diallo. I think that really covered many different dimensions of the engagement with government and the relevance in terms of AAP. Charlotte, we've got 10 minutes left, so I'm going to ask you in 2 minutes if you can just really answer. We've had a specific question in terms of managing a call center and who should actually do that, particularly given that there's often a lot of competitiveness in environments. And I can say also from our side, having worked on this area, sometimes there's a reluctance for agencies to work together in terms of this collective area, not just because of competitiveness, but also because of the information that can be collected, the sensitivities around that, particularly as sometimes it involves complaints and difficult issues that people don't often want going everywhere. So can you elaborate a little bit about how you get consensus in a competitive environment and who should actually manage a call center?
Thank you very much. It's a good question. So obviously, as I mentioned earlier in the talk, I mean, for me, a very key part of having a collective accountability mechanism is the maintenance of neutrality. And what's, I think, very nice about the UNOPS implementing this project, UNOPS is the Office of Project Services, is that we are implementing on behalf of various agencies initially, and increasingly working with more partners. So for us, it's I think who should manage it is someone who can remain, or which can remain neutral, and obviously adhere to international standards on data protection, information management, the do no harm principles, and also has an understanding of how to tap into referral pathways, etc. A key way of how we've kept partners on board is to make it a very inclusive engagement process. We find our board meetings are very useful. We get everyone together on board. There's a strategic direction. People discuss ideas, and it's very much this collaborative interagency spirit, which we've managed to maintain. And I think that that's really helped to take away some of maybe the territorial fighting that might happen in other areas. And in terms of information management, then yes, of course, sensitive information is not shared. I mentioned earlier we adhere to high standards of data protection, but we also do share information. Like, we're happy to work with anyone if people want information on food calls from Cook in last month, then we're happy to share that information. And really, my approach to the call center has been, I want to remain as flexible as possible. I want to make sure that we work with partners in ways that also benefit them, so that they can find use for us as well, and that they find the information that we share useful. And so it's really this kind of constant stakeholder engagement and interaction that I think has helped make the call center a successful, neutral platform that people can trust and work with confidently.
Thank you very much, Charlotte. Dr. Diallo, in terms of resource mobilisation, both Charlotte and yourself have discussed that in respect of AAP. Charlotte's discussed some of the challenges associated with getting financial resources and other types of resources for collective mechanisms, and this has come up a lot. What I would be interested from you is how can we be more accountable, particularly to the population, when we don't have enough financial flexibility in terms of the way the financing is put forward, in terms of project financing and other forms for humanitarian actors? What do you think can be done to improve that situation? What can the donors do? What can organizations do? What are some of the specific ways that we can really find ways to fund these important collective approaches?
Thank you very much, Ingrid. If I can offer a couple of thoughts on this issue, I would probably frame it as follows. First of all, the issue of dwindling resources and what we need to do to make sure that actually our donors, who in the context of the Congo have been very faithful and have stuck with us through thick and thin over the past 2 decades, how would they continue supporting us, but doing it in a way that is more qualitative, to just see a better return on investment in terms of addressing acute needs, but also providing the framework for more resilient communities as we move forward. In the context of the Congo, we've been blessed in having a tool called the Common Humanitarian Fund, or the Pooled Fund, which over the last 10 years have been working very well and has been relatively well supported by our donors. Year in, year out, actually, we have received around 55% of our resources that we've requested through our humanitarian response plan, of which anywhere between 10 to 15% have been dedicated to the Common Humanitarian Fund. Why am I giving you all that background? Is that the Common Humanitarian Fund is a very flexible tool that has allowed me, as the humanitarian coordinator, within the framework of the CHP management board, to provide those type of flexible funding that also comes in with a little bit of capacity building and awareness raising and enhancement of focus from our humanitarian donors on the issue of accountability to affected populations. It is important that these tools are available because they provide that window of opportunity to shape the funding and the programs in a way that also bring these added values. We have still some work to do to make sure that the GHG and the broader donor community can also understand the value of dedicating a small portion of their resources as innovative funding for individual agencies or humanitarian actors that do take bold steps in improving accountability to affected populations. For example, I was talking about UNICEF. The organization has done a great job in making sure that not only it pushes forward the issue of cash programs in the context of the Congo that is very complex, but it has done that in a way that actually most of our donors have seen through the reporting and through visit to some of these programs, how the affected populations have liked the programs, how it is changing the local life dynamics in these communities, how it is impacting the local livelihoods and livelihood opportunities by injecting resources into the local economies, and how it has brought together communities torn apart by war and strife, by showing them that actually they can trade together, they can share opportunities, they can share goods. So by doing that information, UNICEF has gone a long way in providing us with the data and the advocacy tools that we need to continue advocating with the donors on why it is important to fund this. The second thing that I wanted to say is even on the government side of things and the national NGOs, most of them have goodwill and good connection at the community level, but the lack of capacities is something that hamper them and limit their capacity to be fully operational or take the full operational capacities out to try to help us implement programs. By providing seed funding that also improve their capacities, build skills, build knowledge base, builds capacities to collect and analyze data. It may seem a big investment, but actually the return on that investment is also very good. And the Humanitarian Pool Fund has helped us to do that. My call to our donors is to let them know that actually if they support us in pushing this forward, in the coming years we'll see a good return on investment because we'll get a solid buy-in from our programs, our government, our partners, and also from our affected people, which combined together will give us the environment that we need to succeed in having a good accountability framework, but also improving the lives of the people that we meant to serve. Over to you.
Thank you very much, Dr. Diallo. And on that really inspirational note, I'd like to thank everybody for participating in this webinar, and particularly to our eminent speakers, Dr. Diallo and Charlotte, who are calling in from various locations in the world. I'd also, just before finishing, like to point you in the direction of our website, deliveraidbetter.org, which has a lot of information, and we will be putting all this information up. We will also be sending a webinar summary as well as a note that has been developed on some key steps that humanitarian coordinators and humanitarian country teams can take to really move forward on collective AAP. This will be circulated to all of you in the next few weeks. And also to highlight, in your chat box you will have seen a link to the SAVE project. GPPI was a partner within the SAVE project together with Humanitarian Outcomes, and this is a fantastic project that really pulled together a comprehensive data set looking at a variety of different areas in terms of conflict environments relating to access. And one of the key areas was on AAP. There's great learnings that you can look at that are very practical, that were pulled together over 4 years. I was part of that project. I thought it was excellent. They really knew their stuff. So please have a look through in terms of there as well. Thank you, everybody, and I hope you can join us next month for our next webinar.